I'm going to be performing my lab skills of fundal massage and peri care. The first thing we're going to talk about is fundal massage. The reason we do it is to prevent postpartum hemorrhaging, and the massage induces contractions and restores muscle tone to the uterus. So the first thing I'm going to do is wash my hands, put on some gloves, introduce myself to the patient, and explain the procedure. I'm going to first have her void if she can. Next, I'm going to assess for any bladder distension. Also, I'm going to make sure that she's in a supine position with her knees flexed. And I assess for the bladder distension because that can cause bleeding. And if she has a distended bladder, I'm going to have to order a urinary catheter. So once I assess that there's no distension, I'm going to place one hand on the fundus and the other one, the uterus, which is near the symphysis pubis. And I'm going to press down firmly. And this massage takes about 1 minute, no more, no less. I'm focusing on the fundus to get that back to the firm, like how it was firm before. Also, I'm going to be pressing down to expel any clots downwards. And we're going to be doing this the first hour every 15 to 30 minutes. And then after the second hour, it's going to be every 30 minutes. And then we're going to keep doing this every 4 to 8 hours. Now, if hemorrhaging does happen anyways, we're going to have to monitor her vital signs, assess how much blood she is losing, call a rapid response team if it is a lot of blood, administer an IV with a solution as needed, any medications such as oxytocin, and monitor her output. Also, she might need a blood administration. So as needed, we're just going to have to monitor her because that's a very serious complication with postpartum. So the next thing we're going to do is peri care. And the reason we do this is for the comfort of the woman, to prevent infection, prevent skin breakdown, and to prevent odor. So the first thing I'm going to do is wash my hands, put on some gloves, introduce myself to the patient, let her know the procedure. I'm going to help her out of bed, and I'm going to have her wash her hands. I'm going to have her, we're going to remove the dirty pad, make sure I'm assessing how much blood was on there before I throw it away. I'm going to have her void, and then after she voids, I'm going to have a peri bottle, which is going to have warm water, and I'm just going to squeeze it over the perineum without touching or opening anything. It's very sensitive down there, so just squeezing warm water to wash it away. And then we're going to, if she needs any ointment, first we're going to pat from the front to the back and just in a patting motion. And then we're going to apply the ointment if that is ordered. And we're not going to put a clean pad on until 2 minutes after the ointment to let it dry. We're going to grab a new pad and only touching the outside, not the part that's going to touch her, and be very careful with that. And we're going to apply that. And then I'm going to have her stand up before we flush the toilet because we don't want any splashing going on. We're going to be doing this peri care every time she voids, passes a stool, or every 4 hours. So I'm going to document her reaction and the amount of blood that was on the pad or any blood that was voided at all. I'm going to help her back into bed. I'm going to monitor for clots, lochia, any cramping as well. And then lastly, I'm going to make sure I monitor when she's back in bed and all relaxed, her position, pain, periphery, and the pump. That is the end of my lab skills.